To unpack this a bit more further for us, we're now joined by a health rights attorney at Section 27, Asiphe Funda, and she joins us now via our video link. Asiphe, thank you so much for your time this evening here in SABC News. I mean, let's continue to talk about, the hurdles that many women in this country are faced with when trying to access a safe and legal abortion.
Thank you for having me, Mbali, this evening. There's quite a number of hurdles and barriers that women in South Africa still face when accessing abortion, even though it's legal and we have a very progressive legislative framework. Firstly, physical access. You find that particularly in rural Eastern Cape, Limpopo, Northern Cape, there's actually very few abortion providers. You find that women have to travel for 3 hours and have to spend a lot of money that they cannot afford. And this is particularly worse for second trimester abortions. And this has been a huge issue because even in interviews that we've done with facilities in the Eastern Cape and Limpopo, we found that there's not enough trained abortion providers. There's not enough resources. At times, even the drug to perform the abortion is not available, or you find that there are no other equipment that are required to perform a safe abortion. And this leads to burnout amongst the healthcare providers that are there to actually perform the abortions. And another issue that we found increasingly worrisome is the issue of healthcare providers objecting conscientiously based on religious beliefs against performing abortions, even though they are assigned to first or second trimester facilities. And we found that even the application, or rather the lack of regulation of the conscientious objection, is a huge issue, because when we interviewed some of the nurses who objected, some of them said if they were to be paid as a special skill for performing abortions, then they wouldn't object. Some would then object based on the gestational period of the patient, saying that no, they are not willing to perform an abortion above 16 weeks, even though they work at a second trimester abortion facility. And it's important to note that according to the choice on termination of pregnancy, women do have a right to abort up until 20 weeks and 6 days.
And as much as women still have that right in this country, and it's been there for more than 20 years now, but, trying to access a safe and a free abortion in our healthcare facilities also seems to be a challenge for many women. I mean, they speak about this. We also heard it in some of, the voxies we saw in that package. And one would say, why is there still this stigma attached, to trying to access, safe abortions, particularly as well, even from healthcare professionals, often women are shamed or they're even judged, when they have the access to these facilities.
It's still a huge issue, Mbali. You find that women are discriminated against based on socioeconomic background or age. You particularly find that healthcare workers shame younger women who come in to access abortion services. And a part of it is the department not performing enough values clarification with the healthcare providers, as well as actually sensitizing them and also informing them that abortion is a human right. It is not a choice that is up to an abortion provider. This is a constitutionally guaranteed right to reproductive rights and also bodily autonomy, including access to healthcare rights. So it's still a huge issue. Women face discrimination on a number of grounds: disability, socioeconomic background, age, and you find that, as I've said, there's also this issue of conscientious objection, and linked to that is the issue of people's religious beliefs, or rather traditional values in some instances.
And of course, I mean, as much as, there is free abortions in our hospitals and clinics in the country, at the same time, because of the stigma and being judged and being shamed by some in the healthcare sector, many women actually resort to backdoor abortions. And maybe let's talk about that. How widespread is, the problem of illegal, unsafe abortions in this country?
Mbali, I have to start by noting that it's quite difficult for the government and even civil society to keep track of the number of people who attend to these illegal providers, because what you'll find is that some women die and they are not accounted for, and some are successful in some of these abortions, or they present at hospitals as incomplete abortions and they are not recorded as abortions from illegal providers. But from what we've heard, particularly from the organization IBIS, it's up to 26% of women in South Africa who still access abortion at illegal providers.
Perhaps what needs to be done, in order to achieve the full and respected reproductive rights for women in this country, and for this to actually be recognized?
Most importantly, the government needs to start implementing its legislative mandate. Every province must have sufficient clinics and facilities that provide abortions. They should be well-resourced. Drugs should be available, equipment that is required should be available, and they should actually encourage their staff members to actually perform abortions. And this starts with supporting providers when they actually volunteer, and actually protecting the staff members even within the facilities, because what we found is that the providers who then volunteer to provide the service then face discrimination within the facility. They are isolated, they are attacked, so providing that level of support, and also more broadly, access to information. I do not know how many times I log onto social media and women do not know what their closest facility is, or that they even have the right to access abortion up until 20 weeks. So those are some of the important foundational actions that the government can take. And also, just even as a society, not making abortion this hidden topic, but being open to speak about it. And also having media that actually reports accurately and positively on abortion in South Africa.
But do you think that, great strides have been made in terms of dealing with abortions 20 years onwards? I mean, 20 years ago, it was, very taboo to even have this conversation about abortions. Would you say that, more women know about their rights in some areas in this country, and there seems to be an improvement as well in access to information?
There's improvement, Bali, but we are not where we should be. Post 20 years since the act was enacted and abortion became legal in South Africa. We are nowhere near where we should be. We've seen in the news women sleeping on the floor at hospital. We've seen women speaking about being turned away from facilities. And, there's disparities on the access to information and availability of facilities between urban and rural women. So we cannot just look at the perspective of urban women, which is really better than the perspective of rural women in South Africa, who have to travel so many hours and arrive at clinics at 1 a.m. in the morning to wait in a queue without any guarantee that they'll be assisted. That is not where we should be more than 20 years.
Yeah, certainly, Asiphe. Thank you so much for your time and providing that insight for us tonight. That is Asiphe Funda. She is a health rights attorney at Section 27.